Welcome back, ladies, tonight. So Dr. Lewis and I were talking about a program for chronic pain patients, and he's going to elaborate a little bit about that.
And sure, most of the big medical centers and most pain management practices have really tried to evolve exactly what you described, following patients on a regular basis, looking into alternative treatments as well, because many patients, especially in California, have a lot of questions about other treatments that can be used besides meds. And more importantly, getting patients to exercise, maybe getting them into the pool, teaching them certain things that they can do. And pain just has such a wide variety of options that we can utilize. Sometimes it's true, we need to do an injection or we need to do a procedure. Other times it's something more straightforward, like helping patients to meditate and find ways to relieve the anxiety related to pain. So good programs throughout the country, and most physicians that are really calling themselves pain management specialists should have that as part of the way that they treat a patient as a whole person, realizing, as you alighted on earlier, that there's a spiritual as well as a cultural experience that people bring to the table, and that everybody doesn't just want meds.
No, and so I want to ask you, how do you approach a patient that comes to you for pain management? You know, for example, somebody that's been taking pain medication, say, for 5 or 6 years, and basically can't function without them. What do you do? How do you approach them?
Sure, no, and that's a good point, and that's something I see every day and everyone in pain management. As simple as it sounds, I literally go back to the basics, trying to make sure that we're pretty clear on what our diagnosis is, what it is that we're trying to treat, and then also likewise looking at some of the more basic medications and therapies that exist that may not be very complicated, meaning we may not be talking about a complex surgery, but for example, acupuncture. That's something that's been around for thousands of years. There are some people that are very afraid of needles, but acupuncture is a very helpful modality for patients that have certain types of pain, and we'll have a discussion about that. Likewise, I try to get all of my patients into physical therapy. It's covered by almost every insurance, and sometimes we can focus on a particular part. It may just be that the patient's shoulder is hurting, or there may be a shoulder and a knee issue. I will decide which one's more important and prioritize that one, and then write for a set of physical therapy sessions down the road for the other body part. Using patches or pain formulations that do not have opioids is another consideration. And then final piece is really trying to deal with that psychological support, because many people do. They need a support group. They need to sort of essentially be surrounded by love. They may need a psychologist to really help them work through their diagnoses. So it's sort of a holistic approach.
Well, I mean, I could say something like, I've heard my patients say, I don't have time to go to physical therapy. I don't have time to get in a pool. I need to go to work. And the best thing that works for me right now is this medicine. So I don't know what to tell you. What do you say to them?
No,
I'm sure you've heard
exactly
that.
Right, and it's a harsh reality, and it's true, and you're right. And I think the biggest things are having patients realize that, as you stated, these medications, especially if they're opioid-based, can become very dependent and habit-forming, and that in the hustle and bustle to rush and take care of other pressing financial matters, which certainly everyone has, neglecting one's health in this arena really is a mistake. So I really do try to work with them, but you're right, many people do set up walls, and so I try to go to a more basic regimen. Okay, can you give me 15 minutes a day that you're going to commit to walking? Can you, I will sometimes use the fact if they have children to get them more active and get them out. So really trying to allow them in their own situations
and their lifestyle
to find something that allows them to begin to exercise, because that is such an important piece. Pain really does limit function. It limits people's ability to walk or have loving relationships. They many times become depressed or frustrated by not being able to participate, so they start to isolate. So my goal is to really sort of get them out, find out what they like, and if necessary, as you said, try to find a way that they can make the time sacrifice, because I do believe there's nothing more important than your health, and only relying on medications is a very risky approach.
It is definitely a risky approach. However, sometimes I've heard, for example, I teach vocational nursing.
Right.
And so I tell my students, when you're answering a question, taking your boards, you're going to take care of the physiological part first.
Exactly, right, right.
You're going to take care of the basics. So if the basics are going to work, taking care of your children, you either struggle through the pain, or if you find a relief, then you deal with that. And so I'm sure that your job is very challenging, because it's difficult to change habits.
Exactly, and that's probably the hardest. Behavior modification is probably the hardest thing to do. And so one has to provide education. So we really explored a website that has lots of resources. You mentioned the videos and lectures. We put all that in there. A lot of articles about other types of treatments, hoping that people will access them. But also I email that out to the patients. I provide the newsletters for those that may not be on the internet in the office to learn about other treatments, because the hope is that if you keep coming forth with a message of the importance of exercising, the importance of good sleep, the importance of eating right, and we could talk forever probably about the weight management piece of controlling pain, then hopefully you eventually strike a chord. But you're right, keeping it to the point. Some patients will be dependent on meds. That's what they want. It's quick and simple, and our job is to provide that need in terms of monitoring them, but constantly at the same time saying, okay, I'm going to keep bringing forth other ideas that may help. And eventually patients do find out that the medications aren't complete in their cure.
No, and it brings me to ask you, which is probably one reason why people abuse prescription medication.
Right. Well, I mean, bottom line is that these medications do foster tolerance. Your brain changes its chemistry as you take them. It gets used to them being around, and just like any drug, especially illicit type substance, even though these are legal, after a few months of taking these, they are hard to get off. And I think, as we talked on earlier, it can often scare people from taking the medications. We don't want them to suffer, as you were talking with your mom. So we find that those that are more stoic, they may have a little bit more time in their lives for the therapy, for massage, for acupuncture, for going into a heated pool. For the younger people, we really have to be careful that they don't slip into abuse, because their tolerances are higher. They can take a lot more.
Exactly. Not only is their tolerance higher, but their judgment is a lot lower.
Exactly. No, it's true. And when I'm not talking, children and teenagers, we're talking 20 and 30-year-old, quote unquote adults. But these medications are very good at manipulating and tricking one about the pain, such that if you start to slip into a bit of withdrawal, it comes across as, oh, my pain is increased, and so, well, I'll take a little bit more medication. And so, and many people drink wine, and they don't consider that necessarily be a problem, but with the alcohol and the medication, again, tolerances build even faster.
That's a deadly, deadly combination. Yes. But before we take a break, what are some of the popular alternative treatments for pain?
Sure. Well, we touched on acupuncture as one of the big ones.
And I've tried that too.
Sure, yeah, and physical therapy. And I encourage people to do it. More and more of the insurances are covering it. But certainly meditation. We like yoga, which is excellent for stretching. And again, we're talking milder forms for people that may be a little bit older. Restorative yoga is much more relaxing and not as quite intense with some of the poses. Yeah. And so that heat and really being able to stretch.
It's good psychologically, right?
Right. Oh, absolutely. Yeah. And that's such an important part. I mean, I'm glad you mentioned that, because we can't feel that pain is only in a completely physiologic realm. That's an important piece, but certainly our mind plays a role with how we interpret it. Pilates is great for strengthening one's core. So we really try to, especially in the Bay Area, we have so many abundant resources of classes that are inexpensive, some which are free for a trial, some which are on a sliding scale.
Right.
So we try to talk to our patients about Feldenkrais, about Reiki therapy, other forms that they may have really not ever considered. Sometimes these classes are in the evening as well, so that people can
go
after
to
work.
them after work.
Right.
And I would imagine that if you're really serious about getting rid of your pain, nobody wants to be dependent on anything.
No.
But nobody wants to sit and not be able to do much
Exactly.
either.
Right.
So it's sort of a real fine line that your job is. Is that not right?
Exactly, yeah. We feel like we definitely walk this tightrope between not fostering dependence on medications, but at the same time not having people feel that they can't do anything about their pain except take meds, and so they won't explore these therapies because they're busy or because they have a family to raise. We have to constantly find easier ways for people to access physical therapy. Many times, for example, for some of my older patients, I send physical therapy to the home.
That's good.
Readily available, and all we have to know how to do as providers is to write the appropriate prescription, know the agency. So many times it's not realistic to expect a senior to get out to physical therapy given all the logistics of getting transportation.
Exactly. Ladies and gentlemen, we can go on and on. I want to thank my guest,
Sure.
Dr. Lewis, so much, an important topic.
Absolutely.
We hope that you've learned something tonight about pain, because it is definitely a topic that many people are touched by. There's so much abuse out there, but we want you to know that there are alternatives to your pain. There's ways to get around taking prescription drugs, and if you don't want to take opiates, there's other ways to do it. So you can find Dr. Lewis where?
Sure. I've got a website with my name, Dr. Jet MD. And so just like it sounds, drjetmd.com. And so that's certainly very simple. And there we allow people to email us. We'll respond to questions that come up. We have tons of articles. There's a blog there. But more importantly, some of the videos that we've done with lots of different TV studios, as well as many of the articles that we have in the popular press are available for people that want to learn more about pain and more about what we're doing.
Wonderful.
Sure. Thank
Thank
you.